Hi, good morning. Welcome back to today's video, and today we'll be talking about dental treatment, dental care. And just a background story, I had a dental treatment in, I think, November 2022, so about a year now. And because it's a year, so I feel that at least I've gotten to the point where I can talk about it, where I can say something about it and be able to help anybody that is out there that wants to have a dental treatment of any sort. So I I used to have dental issues, which I didn't know earlier on. It was suddenly maybe 2 years before 2022, maybe 2021, 2020. That was when I noticed it, that I had issues. I always knew that I had like tiny teeth, but I just said maybe it's just the way God created me, but not knowing that there is an issue. But suddenly they started giving me issues. When I went to a dentist, I did a lot of scan and test, and I was informed that my milk teeth didn't fall off. Some of them didn't fall off when they should, so they were still present, thereby preventing the ones that were supposed to come up. So that gave me issues. So it's kind of, in plain terms, the milk teeth has expired, and I was still using them as an adult, so they were not able to do the things I needed them to do, like chew chicken and beef and everything. So I was like overworking them. So they needed to be blocked out, all of them. I had like six, and so it was an issue. I had to pull out one, which was the main one, to the best of my knowledge then. But it didn't stop the problem. It reduced the pain, but it didn't stop the problem. And if you have experience with dental pain, it is one of the worst pain in this world. So I had to go to get treatment in Turkey. So I did dental treatment in Turkey, and particularly I did zirconium crowns. So what I have on now is zirconium crowns, and for, if you don't know about it, it's not the ones that you have to take out, like remove when you want to sleep, or maybe when you want to eat, you take it out. No, you use, it's just like a regular teeth. It's just like every other teeth, like your normal teeth. It is, you can do with it the same things you can do with your normal teeth. That's the same things you do with it. But the main focus of this video is to tell you the limitations, because if it is not natural, it is not natural. They can't be the same. As much as, wow, this is wonderful, like I can boldly tell you that it is, let me say, maybe 95%. Like I don't have any kind of pain, I don't have any kind of issues. I'm very comfortable, even cosmetically, like with my smile is better. So that's a plus. But there is but. So that is the focus of this video. Number one but is that, first of all, in case if you are still on this, that is regular toothbrush, you have to switch to this, that is electric toothbrush. Is sorry. It's because, it's not just because you want to switch to electric toothbrush. That's not it. Is the dentist prescribe it specifically. This is oral B products, but I'm not, it's not for any kind of advert. I'm sure there are maybe better ones or anything, but I don't know. I just prefer this one, and I also prefer the toothpaste too, in case. But this one, because of the way your teeth is now, because with the zirconium crowns, they do it, I don't know how to explain it because I'm not a dentist, but because of the way this toothbrush operates, it just goes round. It will be able to penetrate into the tiny spaces that are in between your teeth to pluck out any kind of maybe bacteria or any thing that you got from your food or any kind of thing. But if it's your regular teeth, if it's your natural teeth, some people have a lot of space, so they can easily pull it out with anything, or the toothbrush can help. But with this one, it will be more like very convenient to release all those germs that have been hiding under there. So if you are going for it, or if you're in it already, or if you're having any dental issues, electric toothbrush will help. Or at least it will help in one way or the other. Another thing is that no more toothpick. You can't use toothpick. Not because you can't use them. Everything that I'm saying here, you can do it, but at owner's risk. You can do it, but at the same time, be ready for the consequences. So because right now, the zirconium crowns are covering your natural teeth, and because it's not natural, you are prone to infections, every kind of infections, if you're not careful. So when you use toothpick, you be opening holes that are not required to be open. That's one. Two, your teeth doesn't even have enough space for the toothpick to penetrate. So because of that, and definitely if you're uncomfortable and you need to pluck something out from your teeth, you will have to press it. So by then you're opening a hole that is not supposed to be open. So in this case, please just throw this away. Use your toothbrush, brush your mouth if you feel that there is something there. Brush your mouth, or you floss it. So that's it. Throw this one away. It doesn't help in any way. Instead of it to help, you will hurt yourself, then you get bacteria, and then you go see a dentist, and you know how painful it can be. If you know, you know. So please save yourself from all this stress, okay? Thank you. And one more thing. How this zirconium crown thing, how this dental treatment turned me into a posh lady. You can't do the things that you used to do before. No, 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 no. So one of the things that you will stop doing automatically, you don't need anybody to tell you to stop doing it, is, for instance, look at this knot here that I tied. You can't untie it. Usually, normal, you just try. Maybe if you can untie it with your hand, you use your teeth to do like this. You can't do it again. As much as this is working perfectly, it can do chew all the chewables that you want to chew. At the same time, it doesn't have the same sharpness. It doesn't have the same, I don't know, sharpness, that's the best word to describe it, that your natural teeth has. So you can't even use it to open a knot, no matter how loose or anything. But if you want to use your teeth, it will not work. So it's better, if you can't do it, you cut it off. That's the best idea. Or just try as much as possible to use your hand, or maybe ask for help. So that's another one. And again, you can't put your hand in your mouth to maybe cut your nails, no matter how minor or whatever your cutting is. You can't just do like this. No, you're already a posh person, so please stop doing that. You can't do it. You have to use your nail cutter. Use your nail cutter and cut your nails. Please don't bite your nails. The teeth will not even agree to bite. Like, the teeth will not work. It can't bite your nails. It's not that sharp to bite your nails. Imagine, you can't bite your nails. That's it. So use your nail cutter, please. Say if you're on the road, wait, be patient. When you get home, you use your nail cutter and cut your nails. And you can't even bite somebody. For people that likes biting somebody, whether jokingly or seriously, you can't bite. If you try to bite anybody, it will even be painful, like, and you won't even get that biting feeling. Look how I'm talking, like I have experience in biting. But anyway, you can't bite anybody. You can't do anything that requires that sharpness with your teeth. That's another thing. And one more thing before I go ahead. When you're brushing, try as much as possible to use your mouthwash, because it helps with the hidden bacteria. Because of the tightness of your gum now, because of how tight your teeth is. I'm just talking from experience, because before now, I have a lot of gaps in my teeth, like a lot of them. So I don't have issues with, like, oh, I ate chicken or something and it's there. I do have it, but it's just something that I can solve with a toothpick or even with my fingers. But now I can't do it. So it's okay, it's good, not just okay, it's good to use your mouthwash because it really helps. Both the freshness and to kill the germs that you can't get to because it's still is tight now. So please don't forget that. Another thing, this is not a good representation because I couldn't see a bottle with like a regular like cork that you can open with opener. I couldn't see one, so I had to just use this for demonstration. But if you know what I'm talking about, you know when you have a bottle of Coke or Fanta or Sprite or any other drink that you need an opener to open, but instead we use our teeth to open it. You can't try it now. They know you can't try it. You won't be able to do it. So I wanted to say they not born you well. But for the sake of people that won't understand what I'm talking about, you can't try it now. So you have to use an opener. You can't use your teeth. Like even if you try it, it will not work. Your teeth will not be able to open it, or you end up hurting yourself. So you just have to use an opener and open it and take your drink. And that's it. One more thing, and the most important, chocolate. Any kind of chocolate, whether white, whether brown, whether black, any kind of chocolate that you eat, you need to brush. You need to brush your mouth. You need to rinse it with warm water, salty, warm water, just for the germs. This is not time to say, oh, but I brushed in the morning. No, my dear, my friend, it won't work. It will not work. When you brush in the morning, you brush at night. Whether you ate chocolate or not, as long as you ate something, or even if you didn't eat anything, just for fresh bread, then you have to brush. Most importantly, when you eat chocolate, you don't just wait for night to come. You have to brush because those germs, those sugar and sweetness will penetrate into your gum, and because you won't be able to take them out easily, when they stay there for some time, it turns to bacteria and then you have infections. That's what will lead you back to the dentist office, which you don't want to go to, and you have to suffer for it. So to prevent that, when you have chocolate, even if you don't have access to toothbrush, rinse your mouth with warm water immediately. If there is salt, add salt to it and rinse your mouth. Please, please, please. This is not time to say, oh, I'm too tired to brush. No, please try. No matter how tired you are, try. Before you go back to bed, before you say, okay, I'm going to brush in the morning, what's the point? No, that time in between when you go to bed and in the morning, it makes a lot of difference because all the bacteria that are in your mouth that was not removed are going to settle there. And when you will be ready to take them out, they won't be ready to come out. Everybody has a mind of their own. They won't be ready to come out. So then they will turn into bacteria that you don't want. So please and please, I don't want to make this video too long, but I just wanted to come and share these points of mine. I'm not a dentist in any way. I'm not even a health personnel, but I have the experience. At least 1 year is a good experience to be able to talk about this. There are a lot more, but I don't want this video to be long, so we have to call it a day. So please, thank you so much. If you have any suggestion in any way about maybe you have similar experience or you think there are other things that we need to add to it, that people need to know about, please, or you have questions about the whole treatment procedure, just let me know. Comment below, and please subscribe, like, and share, and I will see you next time. Thank you so much and have a lovely day. Bye.